It's one of the most lethal infectious diseases known to man, and now Guinean Health Minister Remy Lamar has confirmed cases of Ebola in the capital, the victims in quarantine. The spread of the virus to Conakry, a city of some 2 million people, marks an escalation in the outbreak, which until now was confined to rural areas. By Wednesday, 63 deaths had been reported from suspected cases in the country's remote southeast. Lamar said the virus appeared to have been transmitted by an old man who showed signs of hemorrhagic fever after visiting central Guinea. At least 6 more people have died in Sierra Leone and Liberia from Ebola-like symptoms, most of them after crossing over from Guinea. There's no cure or vaccine, partly because the rarity of the disease makes drug development difficult.
There
is no vaccination, there is no medicine. So the only way to fight Ebola is cleanliness and cutting off the chain of transmission, meaning detecting the disease rapidly and the people infected, then isolating them so the disease stops by itself and goes back to the forest.
But Guinea's few hospitals are ill-equipped to deal with the virus. The country's turned to medical charities and UN agencies for help. At the weekend, medical charity Doctors Without Borders flew in 33 tons of supplies. Foreign ministers from across West Africa have branded the outbreak a serious threat to regional security, appealing for international assistance to control the epidemic. Professor Muyembe says it's high time a suitable vaccination was made for what's one of the world's most potent viruses, which spreads and kills with devastating speed.
The problem with finding a vaccine is the cost, and it's a disease of poor countries. Many vaccinations for Africa is not profitable, so it's still taking a long time. But you're certainly getting to the point where we need these vaccinations to save Africa.
Experts say Ebola's suspected origin is forest bats. In an effort to halt the transmission of the disease, Guinea and neighbouring countries have banned consumption of bat and other forms of bushmeat, a regional delicacy. Guinea has also forbidden public funerals for victims and bodies being disposed of by the Red Cross. Regional airline Gambia Bird has announced that it will delay the launch of services to Conakry, due to start on Sunday, because of the outbreak. Clementine Logan, CCTV.